Now, back to Coastal Living on KZTV.
Everyone, now it's that time of the year to focus on your health insurance. So if you're still searching for the right plan and you have no idea where to turn, we have our friend here, Will Haven, who is going to tell us about all your questions, answer your questions, and hopefully we can get some answers and feel a little bit more confident when selecting our insurance. Thank you so much for joining us today.
You're very welcome. Glad to be here.
Well, okay, so tell us, what are the basics? What are the first things we need to think about when considering our coverage?
Well, if you work for one of the 48% of companies in Corpus that don't offer health insurance, this is the open enrollment for Obamacare.
Okay.
So it's the only time of year that people can enroll, and there's only 2 weeks left.
2 weeks. And so why should we trust you? Tell us about your qualifications and why we need to take your word for it.
Sure. Well, I'm a certified agent, and I
Okay.
have about 12 agents working for us at our agency here in Corpus Christi. We also have a location during the open enrollment in Alice.
Okay.
And so all have been trained and are ready to help people in both English and Spanish, either over the phone or in person.
Very good. And it's good to know that you're bilingual because we have a very big demographic that wants to understand, but in Spanish. Great. So we're talking affordable health care insurance. Tell us, what's the difference between that and any of the other kind of health care?
Well, the term affordable simply means that there is financial help to help people pay for the insurance. And you'd be surprised that even a family of 4 can earn up to $103,000 and still get help paying for their health insurance.
Wow.
The key is they can't have coverage at work, be eligible for Medicare or Medicaid.
Okay. And on average, how much does it cost to get affordable health insurance?
You know, on average, it's about $100 a month, $75 to $100 a month for family coverage.
Okay.
And great benefits with that too, by the way. Very similar to what we have at work.
Really? For only $100?
Yes, because the subsidy, that tax credit that the government pays, that's what makes up the difference in cost.
Oh, well, that's good to know. See, I'm learning too on the show. So how can somebody enroll? I know we have lots of viewers at home that are like, okay, now the light bulbs are going off. How do we enroll with only 2 weeks left?
Well, our office is open 6 days a week, Monday through Saturday. We're located at Staples in Galahar, across from the Walmart Supercenter.
Okay.
And they can come by with an appointment. They can call ahead and schedule, or just drop in. And we've got a lot of people there certified that can help them.
So this is a complimentary consultation?
Exactly. We do not charge for our services. And we have a complete list of hundreds of doctors that they can go to, and we'll help assign them to a doctor. We first check to see if the doctor they already go to is on one of the plans. Because this year, there's 42 different healthcare options.
Oh, wow.
From 3 different insurance companies. So lots of choices. Even if you already have a plan, it's a good idea to come in and make sure you're getting the best coverage for next year.
Exactly, especially if you anticipate needing some sort of a procedure, surgery, or your kids, if they're sickly and you know that that's coming up, a lot of them, it's going around. Now, what about somebody with a pre-existing health condition? I know that can be sort of a concern when you're applying for insurance.
You know, it can be. The good news is that they enroll during the open enrollment, which ends December 15th, goes into effect January 1st. All pre-existing conditions are covered from day one, including any medications, pending doctor visits, lab x-rays. All of that would be covered beginning January 1st.
Amazing. So you don't have to worry about any pushback depending on what your ailment might be. And like,
Correct.
oh, we're not going to cover you because we don't really want to deal with that kind of stuff.
Correct.
Great. And tell me what the benefits are for somebody who is maybe struggling financially and has sort of a large family and the kids to cover. You mentioned there are some affordable options for as low as $100 to cover the entire family.
Yes, in fact, 50% of our customers last year actually paid zero. And so based on family size, as well as family income and the ages, that's what determines your subsidy.
Okay.
And so we also look to see if the children are eligible for CHIP or Medicaid. And if so, we can assist them in getting enrolled in that as well.
Okay.
That way it provides virtually free coverage for the kids, and then the parents can then get a plan on the marketplace.
Nice. You're sort of able to attach additional coverage so that everybody's able to benefit from that.
Exactly.
Now, you mentioned earlier that we can just stop by, preferably with an appointment, to learn more. What are some of the other locations that you have available?
Well, we're, as I mentioned, in Corpus Christi at Staples and Galahar, where the old Whataburger home office used to be.
That's right.
And then we're located in the parking lot in the Physicians Plaza in Alice.
Great. And so for anybody who is sort of unsure, yes, they can come and ask you, what are some things that they want to take into account, whether they plan on speaking with your group or not? What is something that's really important to consider when you are applying for your insurance? Because it can be really overwhelming. I know when I'm going through that, I'm like, can I talk to somebody? There's too many choices. I don't know what half of this stuff means. What are some things to consider?
That's a good point, because at work we may have one or two choices, but on the marketplace there's 42 different options.
That's overwhelming.
So some of the things we ask is who their primary care doctor is. Do they have a specialist that's important for them to be able to see?
Yes.
How many times a year do they go to the doctor, and how many prescriptions do they take? So we take all of that into consideration before recommending either a bronze, silver, or gold plan.
Okay, good to know. Awesome. Well, guys, for more information, you want to visit their group and ask all the questions you need, preferably maybe have everything written down and write down whatever conditions you may be curious about so you're prepared. It's always good to come in prepared. Open enrollment ends December 15th. Visit their Corpus Christi location at 4717 Galahar Road, or you can visit, is it Leavitt?
Levitt Group.
Levitt.com/Coastal Bend for more information. Call them, 361-852-8005. You've got a little pamphlet here with some details and information, informative, educational, and you've got us covered. I like that, right? We've got you covered. Thank you so much for joining us today.
Thank
we
you,
appreciate
Clarissa.
you educating us, and hopefully you feel more confident making your decision for health care. If not, you know you have somebody you can rely on here in the Coastal Bend.